Welcome back to this series on Similar Podcast, where we have been discussing what you and I need to know about hepatitis. My name is Patsy Mokunga, and I'm still your host. I've been having the most informative and educational conversation with Dr. Ganiyat Oyeleke, who has been telling us about hepatitis, all that we need to know about it. And we're going to pick up this conversation from where we left off. Here, we're talking about transmission and risk factors. Thank you, Ma, once again for being here with us. I'm really having a very good time because
Thank you for
I'm
having
learning
me.
so much.
Thank you.
So we already started talking about this, but I would like us to, go over how hepatitis is transmitted, from person to person, how a person can get it, just over again.
Thank you very much. So we've highlighted the different types of viral hepatitis: hepatitis A, hepatitis B, hepatitis C, hepatitis D, and E. So I'm going to take them once each at once so that
Okay.
it's easier that way. So for hepatitis A, the transmission is through what we eat and consume. So it could be food contaminated with the virus, it could be water, it could be contaminated hands, and it's what we ingest generally. Hepatitis B is the one that is most prevalent in Nigeria. We talked about it occurring in close to 10% of the population, and about 300 million people worldwide living with viral hepatitis B.
Wow.
Yeah, so for hepatitis B, the transmission could be different routes. So we have the blood-borne transmission, meaning through blood, and that is where the sharps come in.
Yes.
You've made a good example of somebody that you knew from way back with childhood exposure. So it could be child to child, it could be mother to child transmission. A pregnant woman, if she's positive for hepatitis B, can pass it on to her child when she's delivering the baby. It could be from transfusion of blood, so if someone receives blood that was not properly screened. Now, it's compulsory that you must screen blood for hepatitis B, C, and even HIV. So if one gets blood that's where it's not properly screened, or sharps, and this is very, very important, particularly for the public. So you see people doing roadside manicure, roadside pedicure. Some will be doing different things. They cut the uvula. They said they are cutting, in Nigeria, we call it belu belu, something along the throat that they cut off. Yes, it's done. We do that.
Never heard
Then
of
you
this.
have
Wow.
then it's available, and I'm sure the audience will know about it.
Wow.
Then tribal marks.
Okay, sure.
So if it's done with clean disposable instruments, no problem. But there are times when they are reused. It's the act of reusing that is the challenge. So we need to know that. Then even for men that go to barb their hair, when they barb, sometimes they shave too close. You don't need to see the real blood. Sometimes there are all those microscopes.
Yes.
I'm sure sometimes when the men, when they shave and afterwards they put something to clean, you feel that tingling thing. So it means that exactly you've been caught. So things like that, sharps, very, very important. And there are times then people, they reuse needles. People that use the IV drug users, abusers. So that's also very important for us to highlight. And of course, sexual exposure is also a cause that we need to, unprotected sexual exposure. So we need to be very, very careful with this. So blood transfusion, there are some people, because of other conditions like sickle cell or they're on dialysis, they need to have all this. And so we must know that hepatitis B can be transmitted through all these routes. Then hepatitis C is majorly blood.
Okay.
So I've highlighted similar to hepatitis B. In fact, when we're screening B, because we know that B is transmitted through blood a lot, we screen C together and HIV together because they can pass through similar routes of transmission. Then we have hepatitis D.
Okay.
You cannot have D without B. So hepatitis D is an add-on to hepatitis B. You can only have hepatitis D when you already have hepatitis B.
Wow.
All right. Then we have hepatitis E. E and A have similar way in which they are transmitted. And you recall I said,
yes.
exactly. You're a good student.
Thank you so
Good
much.
job. So so hepatitis E is transmitted similar to hepatitis A. So as you can see, I know initially you said, oh, you thought they are the grades. I'm sure you now understand that there are different viruses pass through. Some are similar in the way they are transmitted, but they are completely different viruses. But they cause the same issue with liver damage.
Okay, well, it seems rather broad. It has a broad spectrum of just how this thing can move about. But generally, who would you say is most at risk of, contacting hepatitis?
Okay, thank you very much again. So you can see that we have different ways in which they are transmitted. So if you pick hepatitis B, which is the one that is most prevalent and the one that we worry much about, would say the people that are most at risk are the people that have more exposure to the way it's being transmitted. So if you say blood, for example, that would be the healthcare workers, for example.
Yes, I was going to
that are in contact with blood, taking blood sample, setting IV line, doing surgeries, things like that. People taking delivery during birth. So they are the most. Then the next group will be people that have unprotected sexual intercourse, maybe commercial sex workers and people like that, or people that have multiple sexual exposure. All right? So unprotected. If it's protected, you're covered. But if it's not, then whoever patronizes if you go, I always tell people now that when you're going to do your pedicure, please go with your set because you don't know
how neat they are keeping,
exactly.
whether they are sterilizing, whether they are reusing.
Exactly. So you have to be very careful. Go with your barbing kits if you have to do that. Go with your manicure or pedicure sets if you have to. And for patients that are on dialysis, for example, or sickle cell patients that need to have blood transfused repeatedly. So it's important that we ask or to make sure that the blood that they are given is properly screened before they are transfused. And right now, it's compulsory because I know you mentioned childhood exposure. All children born in Nigeria now, it's
not screened for it.
They are not. They get the vaccine.
Oh, okay.
It's part of the National Program of Immunization. So all children born in Nigeria now are protected from birth before they start to get exposed to the infection in school.
I'm very, very happy to hear that. I wasn't aware that has become one of the
yes, it has.
Compulsory. Thank God. All right. So I think the next time with every disease, every health condition, there's always some misconception out there about it. Like, I think there was a time in my life I believed hepatitis was strictly sexually transmitted. Then I now saw somebody that got it through blood, and in my mind, okay, it's either blood or sexual intercourse that can cause it. Now you said food, I don't know that one. So I think my question is like, what misconceptions are out there about hepatitis that people have?
Thank you very much. This is a topic that I usually like to discuss because there are several misconceptions on viral hepatitis. So there are many misconceptions, and you've mentioned one or two that people always feel, and I'm going to start with that, particularly because of the way it's perceived and the consequence, which is stigma, which we need to really address. Once you say you have hepatitis B, for example, people look at you and say, oh, she must be really wayward because they assume you caught it sexually. So, and this is the essence of this education, to let people know that it is not through sexual intercourse only or through sexual exposure only. Yeah, right, it could be a cause, but to assume that every hepatitis means that you sleep around a lot.
Into conclusion.
Exactly. So that is one misconception I'm going to start with. Other people believe that, because I went to use one toilet last week, that was dirty. That was how I caught hepatitis B or C.
Mm-hmm.
They are not transmitted through using dirty toilets.
That's not something you have mentioned at all.
Please, it is not part of it. The other thing is people feel, oh, because I sat near somebody and the person was sweaty.
Oh,
it is not transmitted through sweat, please. So very, very important. Another one is to feel, okay, if I have it, there is one concussion that I can use to make it go away suddenly. And I need to emphasize it because
like all this, people talk about detoxifying. I'm sure
yeah,
they'll say
so
detox your liver.
detoxing liver, using herbal mixture, using different other methods that is not the approved evidence-based method. It's very, very wrong. And we have to be very, very careful because some people now take other things that can cause further damage. So it's
Sure, yeah.
important because I see a lot of websites and a lot of links of, oh, I can cure hepatitis with the different medication.
Even if you go to the market, you hear those people announcing.
So we need to be very, very careful, about all this. Another thing is to feel that, okay, once I have the hepatitis and I take an injection to neutralize it, it goes away. Okay. There is no injection that neutralizes hepatitis once you have it. So you need to be sure that once you have hepatitis B, there are some tests we need to do to check the level. We call it the viral load. To check the effects on the liver, we call it the liver function and the liver enzymes and chemistry. There are other things we do to assess the overall appearance of the liver. We do ultrasound. We can do other advanced tests now. There's something we call the liver fibroscan. So those are tests we do to check. So it's important that all those myths would be cleared.
It's very interesting how misinformation spreads very quickly because you would find, I'm sure there's somebody out there who is listening to things that are misconceptions about hepatitis and they don't even know the real story about hepatitis. If you ask them what is hepatitis, they might not be able to explain it, but they can give you a cure. They can give you one place that you go and buy something. You enter the market, I hear them, they'll be singing it. If you have hepatitis, come and buy, something that you can drink or something.
Because those are chemicals that can further cause damage to the liver. Already, a liver that has hepatitis, we say that there's been an inflammation. And if that inflammation persists and you now take other things or chemicals that can potentially cause damage, we call them hepatotoxic agents, like things that are toxic to the liver. So we don't want further damage. And that includes even alcohol. So if you have hepatitis B, you have to abstain from alcohol because that will also add other further damage to the liver.
From being on this podcast, like even from other episodes, the amount of times alcohol has been raised as a red flag. If you are you are our person, you are watching us, I hope you've stopped drinking alcohol by now because it always comes up. Okay, I think the last thing before we wrap up this particular episode is what easy steps can somebody take to, prevent or to make you less at risk, to hepatitis?
Thank you very much for this excellent question too. And I mean, if you followed us step by step, we've talked about who is at risk.
You should have an idea by now.
Yeah, so we'll now summarize everything. That how can I make my risk to be less? The first thing, if you are a healthcare worker, test that you've tested for hepatitis B and take the vaccine. Hepatitis B vaccine is available. Some, they do not have prevention in terms of vaccination, but B, which is the most common and the one that we feel can cause more damage, it has. So do the test first. If you do not have it, then get protected, immunization. The other one is for people that are exposed with, that have through sharps. Get your clipper, the nail clipper, the manicure, pedicure sets, for people that cannot stop having multiple exposure through sexual partners. Stay protected.
Come and do peachy test. It's a test panel we have at Sinlab.
Okay, so, all right. So that's, and go ahead and do that. And stay protected. Wear protection. right? If you must do that. Then for someone that frequently gets blood transfused, ensure that where you're doing your dialysis or transfusion,
They
that
take
it tests
appropriate.
appropriately and precautions are given. For those ones that are exposed to, we ensure that they get the hepatitis B vaccine. So in fact, what the World Health Organization has stated for those in countries that we have a high prevalence like
Like
Nigeria
Nigeria.
is that everyone should get tested and everyone should get immunized. It's better that way so that we reduce the risk kind of and because there
If
may
you
be
don't
some
have it, you
exposure.
know you get protected. If you
Exactly.
have it, you know
So
how
do
to
the
manage
test,
it.
and once the test is negative, get protected, get the vaccine for hepatitis B. For hepatitis C, we do not have the vaccine available.
But can be managed?
It can be cured.
Oh, wow. In
Hepatitis C
fact,
is now curable. So for
wow.
that one,
That's
the
really amazing.
standard protection of be careful with exposure to sharps and all that still apply.
Yes.
No vaccine for hepatitis C, but if you have hepatitis C, we can cure it with medications.
So it's best to even know earlier,
Exactly.
very early.
So it's important. So the first step is get tested.
All right.
Because once you test and you do not have, then you can get protected.
We're learning a lot. Me, I'm learning a lot. I
Thank
know that
you.
if you're watching this, you're learning a lot. Thank you so much, Ma, for, simplifying this otherwise complex topic, or what may have seemed like a complex topic to all of us prior to now. I know that if you're watching this, you now know, how hepatitis can be contacted. You also know what misconceptions are out there, so that your mind is better aligned towards what to expect, what to not expect, and also how to manage the risk. I'm sitting down here thinking about how, I do it, but how to be more cautious about certain things. Like when I go to get my nails done, I need to be very, very cautious about it going forward. So I know that I'm learning, so you're learning. Thank you very much for being here. Sit tight. We'll be back with yet another episode. While we go on this break, remember to like, to comment, share this to everybody. You've heard how prevalent hepatitis is in Nigeria, and the fact that it is recommended for everybody to get tested, everybody to take the vaccine for hepatitis B. So it means that you have to share this to everybody. So click on that share button, share it to everybody. You can follow us on YouTube and Spotify. You can follow Synlab Nigeria across all social media platforms. Everywhere you turn your face, we are there. I'll be right back with the next episode. Thank you very much for being here with us.
Thank